Hey everyone, it's Emma here from Emma Talks Teeth. Welcome to my page if you've not been here before. I'm here today to talk about job advice for after dental hygiene school. So over the last couple of months I've been receiving a whole lot of questions about my course, what it means to be an oral health therapist, what my everyday involves, and also some questions about jobs and tips for interviews. Now today's video is about job tips, so stay tuned, let's get started. So my first question is from Maddie and Justina. They sort of asked a similar question. They've asked what a typical day is in the life of an oral health therapist, and what appointments do I usually have, how long are they, and how do I structure them? So it's a pretty long question. I'll try and break it down as concisely as I can. But basically, I arrive at work about 15 minutes before patients, so that just gives me time to change, just because I usually walk to work, have a look at my books quickly before the day starts, if I've not already looked at them the day before. And we also have a 15-minute team huddle before the day starts. So what that huddle involves is just everybody talking about what they've got on for the day, what appointments they have, if there's any clashes in schedules, if there's any patients that are seeing two providers. So for example, maybe seeing me and then going into a dentist. It's always really good to know those, just so we know exactly where to bring a patient and not bring them out to the waiting room when they're not needed there yet. So after the huddle, we get started with the day. My hygiene appointments are usually 60 minutes long for adults, 45 minutes for teens, and 30 minutes for children. I usually have a 60-minute lunch break, and I work about 7.5 to 8.5 hours a day. My day can be a range of just routine recall appointments, perio maintenance, active perio treatment. I don't do a lot of therapy these days, so I am predominantly a hygienist. Any of the complex treatment I either refer on to the dentist or one of the other oral health therapists. If I have downtime or a patient cancels, I'll sometimes help one of the dentists with anaesthetic if they're running late, so numbing up their next patient so they're nice and numb for when they go in to see the dentist. I will go through my appointment book and just see if there's any patients that I can bring forward to fill empty slots. What else do I do? Help the girls out in stereo if they need it. Look through recall lists, which means looking through lists of patients that I've seen 6 months ago, and for those people who haven't rebooked, getting them reactivated, emailing them, or just marking them for reception to contact. I could be sharpening instruments, so there's lots to do when you're not actually seeing patients. Al asks, what is my favorite hygiene instrument? You guys won't know about this from uni, but if you've seen it on Instagram or on social media, the EMS airflow is life-changing. It is the way we should be cleaning our patients' teeth. It is the gold standard. Everyone in the UK, in Europe uses it, and that's where we should be looking. A lot of the advances in periodontology do happen in Europe, and so in terms of hygiene, I definitely think that the airflow will make more of an appearance in many more clinics in the years to come. If you've not tried an airflow, you need to get to one of their lectures, have a look at them online. The Swiss Dental Academy does lots of lectures on the GBT, what it is, how it works. It's just incredible. Like curettes and hand scalers are 20-30 years ago. The GBT airflow is the future, so if you've not tried it, get onto it and start using it ASAP. If you see a clinic that has GBT airflow, go apply for that clinic. Kendall asks how to explain perio to a patient. So I'm not sure if you're asking for like a word-by-word spiel here, but I'll just give you the structure of how I explain it to a patient, and it's the way that I find gets the most conversions in terms of treatment, because the patient actually properly understands why they need the treatment. It's not just because they're told they need it. They understand why, and they want it because they understand why. So first, of course, I start off with what it is. So go through the etiology, blah, blah, blah. It does this. We all know that from uni. But we need to also explain to them how it needs to be treated. I almost present it like there's just no option, because if you leave it, the bone will dissolve and there will be nothing left to hold your teeth in. So these are for advanced cases, obviously, but patients need to understand the gravity of the extent of their disease. And I love the new perio classifications, because we explain it now to patients in stages. So when patients hear stage 1, stage 2, stage 3, it reminds them of cancer almost. That's no comparison, but it's a really good way to have in the patient's head how important it is and how detrimental it is to their health when they hear it in those terms. I then talk about how important home maintenance is. So basically I tell them what I do in here only works if you do what you need to do at home. So the way I say it is, I can give you the best clean in the world, but if you allow that plaque and tartar to reaccumulate, everything I've done for you is all in vain. And then patients need to understand how important it is to come back for their regular preventative care appointments. So it's not just one treatment, it's ongoing maintenance for life, especially if the gum disease has, been controlled. It's never cured and it can relapse. So the ongoing maintenance conversation is really important as well. So I find when you touch base on all 4 of those topics really succinctly, really concisely, and that you make sure that the patient understands everything that you've said, is when you get patients that will come back to you. They will come back for their second cleans, they will book in their peri appointments, and they will come back for their maintenance appointments. So FEANSAP has asked, where do oral health therapists work? So traditionally we can work in community clinics, public hospitals, private practices, of course, corporate dental practices. We can work with specialists such as orthodontists and of course periodontists. The non-traditional jobs we have include lecturers and demonstrators for universities, and we can also do consulting and even sales for dental companies. How many patients do you see a day? 8 to 10 patients generally. If I have a day full of children, I'll probably maybe see up to 12. How many hours do I work? Clinically, I work 3.5 days a week, some Saturdays. I do consulting for 1 day a week, and I also do teeth whitening. So I do that around my clinical days and my consulting days. Sam asks, how often is it ideal to sharpen instruments? So Hugh Freedy, my favourite hand scalers, they recommend for best results that you actually lightly sharpen your instruments after every use. But realistically, in clinic, it's just not possible every single time to lightly sharpen your instruments after patients. It's just the reality. What we do is we just try sharpen instruments in the downtime that we get. So when patients cancel or block opens for a day, we try and do our best to make sure we sharpen instruments then. Just don't want them getting dull and blunt, because you can really feel the difference when you are cleaning your teeth with patients, and it's just annoying for you. You feel like you're not cleaning properly, and it takes much longer as well. So always make sure that you have sharp instruments. And lastly, Justine has asked, how do you run each appointment with patients? Now, this probably can be a video in itself, and it's sort of like the day in the life of a dental hygienist video that I'm sort of halfway through filming, and then lockdown for COVID happened, and so I've just not done it yet. But it is coming. Stay tuned for that, because I will post it as a bonus video, but I'll just show you guys exactly what I do in my everyday clinic and what I do for my routine hygiene patients. So that is it for my job advice video. Thanks for watching if you made it to the end. If you have any other questions, please do let me know. But that is it for today. I will see you guys soon.